Welcome to this overview of the Comprehensive Class Member Transition Program Service Plan tool provided by the UIC College of Nursing. This presentation is designed to provide service planning staff and their supervisors the information needed to use the Comprehensive Program Service Plan tool effectively and to synthesize the information within the assessments to develop service planning goals. The information provided in this training is outlined in policies P3.1, Transition and Integration Planning, and policy P3.06, Service Plan Quality Review. Service plans must be completed in full in the web app for all class members who are active in the CCMTP and have had a completed assessment. The first service plan is to be completed and finalized within 45 days of assessment initiation. This plan is referred to as the initial plan. After this, the CCMTP defines set periods for when service plans are required to be updated. All community moves must have an updated service plan finalized within 30 to 60 days before a community move. This plan is referred to as the transition plan. This time frame has been updated in FY24 to allow case reviews to include information from the transition service plan. Initial plans must include goals and interventions relative to class members' time in the nursing facility or SMERF, including education, skill building, occupational, and nursing assessments. Transition plans must include goals and interventions relative to class members' community needs, for example, obtaining DME, homemaker services, appointments with specialists, monitoring health and behavioral status, collaborating with providers. All class members who reach 17 months in the community must have a service plan completed within the 30 days preceding the 18-month milestone. This is referred to as the final plan. Throughout the transition continuum, all class members must have a service plan no older than 180 days. Therefore, a new service plan must be reviewed, updated, and finalized every 180 days, or as clinically indicated throughout the pre- and post-transition activity periods. Under the CCMTP model, the care manager is responsible for assessments and service plans, as well as pre- and post-transition care management. Once it is determined that the class member is proceeding towards transition, this should be entered into the web app to reflect the identified outcome. See the assessment training for more details. The service plan should incorporate the findings of the assessment and update information where indicated. Service plans are completed in the web app with active participation and insight provided by the class member and legal guardian when applicable. Additional participants may include nursing facility staff, pre-transition, family and social supports, prime agency staff, and providers. Information from other sources such as agency assessments, nursing and occupational therapy assessments, UIC ATU documentation, neuropsychiatric evaluations, and facility provider documentation is encouraged to ensure the service plan developed provides a comprehensive summary of preferences and needs. All sections of the service plan are to be completed before finalizing the plan. These sections include service plan details, which is an overview of service plan and class member details, background and demographics, reflect current insurance, advanced directives, income, and criminal legal involvement. Living experience, class members' previous facility admissions and community living. Housing preference, preferred housing type and location. Preferences and supports, class member formal and informal supports, class member vision, goals, strengths, activities, hobbies, and waiver status. Integration supports, previous experience, current status, and future goals related to education, employment, and volunteering. Transition services indicate clinical and non-clinical supports and services and document their current status. Medical equipment and supplies. Class member indicate durable medical equipment and supply needs and their status. Pending referral, order from provider, referral order pending approval, member in possession of the equipment. Condition status, update the class member diagnosis, medication, and functional status. Individualized plan, Document the individualized plan to address the class member's needs and preferences. Provider list. Current known providers. Plan development. Participants in the development of the service plan. For example, CCMTP staff, facility staff, providers, CMHC staff, informal supports, the class member. We will be going over each of these sections in detail in this training. To add a service plan, click on Service Plan under Assessment. This will open a screen with a list of all available service plans. You may view or download established service plans by clicking on Details or Download, respectively. To add a new service plan, enter the planner and plan date and click Add. This will add a new plan, then click Details to view and edit the details of the plan. Once the plan has been added, review the details in the Service Plan Detail section. Ensure the planner and plan date are correct. If the plan was updated due to a quality review, click the corresponding checkbox. If the service plan was not completed due to a change in status, indicate this in the Reason Not Completed dropdown. Also indicate what type of plan it is using the dropdown. For example, Initial, Transition, or Final. Click Save and Next to save and move to the next section. Using this after reviewing and updating each portion to save your work and move to the next section. The next section of the service plan is Background and Demographics. Review and update any indicated details regarding payer. If there has been a change, click the Apply the changes above to members level as well to reflect the update on the member page. Review and update advanced directives and income, completing the fields as indicated. Finally, review and update information related to legal involvement. Living experience is next. In this section of the service plan, review events leading to admission and the class members' living experiences. These factors become important when planning for needed supports to establish and maintain community integration. Next, you will review housing preferences. This includes information about the projected transition date and the housing locator working with the class member. Planned housing type and reasoning for non-PSH options will also be documented. This is important to establish how consent decree standards are being addressed. Select the class member's preferred geographical location by clicking Neighborhood List. This will bring you to a new window where you will identify priority zones and neighborhoods the class member prefers to live. Zone identifies the CCMTP region the class member prefers, North, Central, or South Cook, or Collar. For Collar region, select NA for Cook area, then identify the preferred county from Neighborhood. For Cook County region, select Chicago or Township from the Cook area dropdown. After selecting the area, identify the desired neighborhood. Proceed to Preferences and Supports, where our family guardian contact information and involvement will be documented. Explore the class members' preferences and their self-described goals and views for community integration. How do they define success? What are their activities and hobbies? Exploring these areas helps the care manager understand what is important to the class member and provides additional focus beyond the housing and clinical needs. This area also identifies the status of Medicaid waivers. Please note that the supportive living program is listed as a Medicaid waiver. If the class member is moving to this setting, the approval status should be documented here. The Integration Support section reviews education and employment history, as well as current needs and future considerations. This includes a review of potential barriers to learning or employment. Information documented in this section is used for special reporting on employment. Transition Services provides a space for care managers to document the needed supports and services, as well as the current status at the time of planning in a checklist manner. Services and supports are sorted by domain, such as mental health services or specialty clinics. If the class member has or needs a service, click the corresponding box to the left of that service. Then select the status from planned, current, declined, unavailable. Planned indicates the class member has a need for this service, but it has not yet started. Current indicates they are currently receiving this service. Declined indicates the class member has an identified need for this service, but the class member declined linkage. Finally, unavailable means the service is an identified need, but the service is not available for reasons such as location or lack of approval by insurance. There are options to write in services within many domains as well. Medical equipment and supplies is used to document the needed equipment and supplies as well as the current status. For example, if a class member uses a walker owned by the facility, this would be entered and indicated as needs and does not have, with an added comment that the class member is using a facility-owned walker and will need their own before community move. Another example might be that a class member has an automated blood pressure cuff but does not know how to use it. This will be reflected as a has and does not meet needs status with the appropriate comments. Any gaps in medical equipment and supplies should be addressed within the individualized plan. Condition status. Review and update the condition status section. This is pulled forward from the assessment. Review and update the documented details to provide an update on the member's health status. This includes diagnosis and related status or symptoms, vital signs, medications, and functional status. If no details have changed, record a note in the comments to document that the section has been reviewed and verified and the date this was completed. The information documented in this section is used for many CCMTP processes, including quality and clinical reviews, as well as reporting of class members' characteristics. See the assessment training module for more details on completing this section. The individualized plan section is where the care manager will document the member-specific goals and the plan to address them. After gathering all needed information, the care manager should then categorize the identified needs or preferences into one of the 7 service plan domains: physical health, mental health, substance use, functional status, medication, housing, and community integration. For example, consider a member who has multiple high-risk medical diagnoses, including hypertension, diabetes, active wounds, and renal disease, and limited experience with self-management. In what service plan domain would this challenge best fit? This need would be classified under physical health. Members typically have multiple challenges in each domain. It is also important to remember that the member has strengths and other resiliency factors that will support them in addressing these challenges. These strengths should be noted as clearly as possible. SMART is an acronym to help service planners develop member-centered goals in a format that makes it likely for them to be successful. SMART goals are specific or short. They address a single need or challenge. They are measurable. They have a quantifiable outcome. They are attainable. They are goals that the member has the ability to meet. They are realistic and relevant. They are related to the need they are associated with and are likely to improve it. Finally, they are time sensitive. There's a timeline for completing the goal. Returning to our example of a class member with high-risk medical diagnoses and limited self-management experience, an example goal might be that the member will be able to demonstrate the ability to independently check their blood sugars 4 times a week by the end of March. That example goal meets the criteria for a SMART goal. It is short or specific as it focuses on a single diabetes management task. It is measurable since the 4 times a week element is quantifiable. It is attainable. It's both a necessary task to manage diabetes, and there are no obvious barriers for the member. It is realistic and relevant since it directly relates to diabetes management. Finally, it's time sensitive since it has a clear end date that's within a manageable amount of time. It's important to remember that goals should have clear outcomes that are related to the identified need or challenge. They should not be outputs, that is, simple actions that the member takes, or general statements about the member. While saying that the member should go to the doctor makes sense as a recommended activity, it's not a goal related to the identified need. The statement doesn't help the member make any specific behavioral change or improvement in their health status. Going to the doctor in and of itself is not going to improve someone's health. What do you want the member to do with the doctor? And how will this relate to the identified need? Finally, you can build interventions to address the identified goals. Interventions should be based on action verbs, things like link, collaborate, monitor, refer, coach, educate, advocate, or support. They must relate specifically to the identified goal and whenever possible include the member's identified strengths. They should also reflect the member's cultural context, that is, their background and experiences, and be considerate of the member's abilities both functionally and cognitively. Given the example goal we've been discussing, interventions that would make sense on the service plan include linking the member to a diabetic educator, collaborating with the facility to ensure the member has appropriate testing supplies, and monitoring the member's blood sugar logs on a weekly basis. While these interventions are all structured as provider-staff accountabilities, interventions can also be written for actions that the facility or other providers must take, or that the member will be responsible for themselves. In the Individualized Plan section, in the first column, identify the section or domain. Then identify the SMART goal to address the identified need. In the next column, spell out the specific interventions or strategies to be used to help the member meet this goal. You must also indicate which party or parties are responsible for implementing the intervention. This could be the prime agency, the nursing facility, the member, or one of the other involved parties. There's a text field where you can be more specific about the provider responsible. Indicate the status for addressing this goal. For initial plans, the status is generally pending, but this should be updated with each revision of the document. Enter a start date and estimate a completion date. Although this is not a hard commitment, this date should be edited as the projection is revised and the service plan updated. Finally, ensure to click the Add button to save the addition. Repeat this process for each goal. Let's take a closer look at the 7 domains of needs, challenges, or risks covered in the service plan. The 7 domains are physical health, mental health, substance use, functional status, medication, housing, and community integration. Updates were made to these domains from previous versions in FY22 to allow more consistency with other CCMTP documentation, while still capturing the required components of the consent decrees. As a reminder, required components include independent living and self-management, community-based clinical services, non-clinical services and supports, housing assistance, housing accessibility and adaptation, and non-housing transition needs. These areas must be included within the context of the service plan. Physical health includes any physical health components, including overall wellness plan, management plans for specific conditions, such as blood pressure monitoring for hypertension, and needs related to specific providers, such as a dialysis center, diabetic educator, or cardiologist. Behavioral health needs are split into mental health and substance use due to the context and impact of the conditions within the population. Mental health components include components related to mental wellness, as well as needs related to mental health conditions such as depression or risk factors such as history of suicidal ideation. Similarly, components addressed within the substance use domain address risk related to substance use. Functional status components include functional needs to transition to and maintain functioning in the community. This should include both formal and informal supports needed for ADLs, IADLs, and other functional needs. Medication management is addressed in the medication section due to the associated risks. When reflecting on functional needs and related plans, it is often helpful to consider the steps related for each task. For example, paying bills not only requires an income and writing the physical payment, but it also involves budgeting, retrieving mail or electronic records, and skills related to payment. Similarly, medication management requires multiple steps, such as understanding provider instructions, filling the prescription, opening bottles, ingesting the medication as prescribed, and monitoring for side effects, to name a few. Plans related to functional status and medication should reflect the areas needing to be addressed. Housing-related components, including finding and maintaining housing and needed adaptations, are addressed in this domain. This may also include items such as planning for utilities and furnishings. If there are identified barriers to housing, they should be addressed in this section. The last domain is now community integration, which includes other components related to full community assimilation. This may include items such as community resources and supports, food supplies, social supports, education, employment, or hobbies. Now returning to the service planning tool in the web app, within the provider list section, the care manager should document the current providers the class member is seeing. This includes their primary care physician, any specialists like a cardiologist or neurologist, or specialty clinics where they are receiving care, such as wound or dialysis clinics. Providers' contact information should be recorded whenever possible. This is a good opportunity for the care manager to review if a release of information is needed for advocacy in collaboration with the provider. The service plan development section documents the individuals who participated in the development of the service plan. This should include, at minimum, the class member, care manager, and legal guardian when applicable. This may also include a supervisor, family or other supports, or a facility representative. After reviewing the full plan, finalize the service plan by clicking the box next to Finalize Service Plan in the last section, Plan Development. Ensure Save and Next is clicked to save the finalized status. The date this is saved is recorded and used for reporting. Before finalizing the plan, review all available information to ensure the service plan is complete. Service plans must be finalized after completion to complete the submission process. The service plans within the web app are designed to pull information from the most recent service plan into the next plan. If additional information becomes available after the plan is finalized, or if there is a significant change in status, add another plan and provide the identified updates. As a reminder, the 24-hour backup plan should be completed before community move and updated as indicated once in the community. Current versions of all comprehensive program policies and forms, as well as educational resources, can be found on the Colbert-Williams training website managed by the UIC College of Nursing. Any questions can be directed to the Colbert-Williams Help Desk email listed on that website. Thank you for your attention and efforts to ensure safe and successful member transitions.